So hi, I'm Dr. Camille Cash, board certified plastic surgeon, and I have my wonderful patient Rochelle here who has agreed to share her experience with the Aviva procedure. The Aviva procedure is a non-surgical labiaplasty that is done to tighten the tissue of the external genitalia, the internal genitalia, and the introitus of the vagina. So it's great for different issues that women have as they've had children and as they get a little bit older, and done in the office with minimal downtime. So I'm going to let Rochelle talk about her experience and her results from the Aviva procedure.
When I came in, I wasn't coming in for that, but after talking to you for a little while, I felt comfortable enough to talk about that and to talk about the incontinence and what I was experiencing. And then when you started to talk to me about some of the options, I felt safe and comfortable in trying those things. And honestly, I thought after childbirth, I had such a bad problem with urinary problems because I had a C-section, and the position of my son was such that it really involved a lot of the uterus was attached to the bladder at some point. So when they did that, it became a problem after the hysterectomy. So I thought that was just something I was going to have to live with. I really thought forever I would have to just, go to the bathroom 10 times every hour and get up at night. And after this procedure, I was amazed because immediately I could sleep through the night. I could take a car ride from one part of Houston to the other side and not have to, rush to the bathroom as soon as I got there.
Right.
So for me, it's been life-changing.
Right. It's not something we feel comfortable really talking about, right? And so I think you came in for something, probably Botox or some neurotoxin or fillers, and then I was super excited about the InMode devices that we had brought into the practice, BodyTite and FaceTite, using radio frequency. And then, of course, the newest device at that time from InMode was the Aviva and non-surgical vaginal rejuvenation and tightening. And so I think it's important because there's a lot of women out there that have issues that they don't really feel comfortable talking about. And they feel like it's just part of life or part of the change or what happens after you have children or you have a hysterectomy. And it's exciting because now we really have a lot of different options and tools to offer to patients. And so one of your biggest concerns was the stress urinary incontinence or the urinary urge where you constantly had to go to the bathroom, correct?
Correct. And never felt like I was emptying my bladder completely.
And then we got some added benefits from the procedure. So do you want to share about that?
Sure, yes. What I didn't expect was that sex would be different, and
Better.
Much better. Much better. And I think for me and, for my husband as well, it just, he, of course, doesn't know all that went into what I did, but it's been good for it, sex. Yeah. So, and that was an added benefit.
Right.
And probably something that, I would never have come to talk about, but it did, because I did have the other problem and because I did feel so comfortable talking to you, it did make it easy.
Life is kind of cruel because as women get older, we often have an increase in our sex drive. We have had children, and then we experience some new freedoms, and then all of a sudden we're hitting menopause and things are changing right at the time when women reach their sexual peak. So it's nice to have a device that can, kind of meet that sexual peak and to get them back from all the years of sacrifice that we had with childbearing or hysterectomy, or really be able to have fun again. So I'm excited that I'm able to offer it to patients, because I think it is something that women we just kind of live with a lot.
Yes, I agree, and I'm encouraging women to not just settle for what you think is what you have to settle for. Coming in and trying this was new for me, but I'm so excited that I did, and I feel more comfortable now talking about other things and trying some other things.
So how did you feel when I first said, okay, this is what we're going to do? I know part of you probably didn't want to think about it too much, but how did you feel during the treatment? How did you feel before the treatment, then during the treatment, and then after the treatment? Can you share that with us?
You know, it all happened so fast, which was a good thing because I didn't have time to second thought and, you know, change my mind. So it happened quickly. I wasn't nervous. I think I was not expecting such immediate results, and for it to be, I just thought, okay, well, I'll try this. And so, and then during, it wasn't painful. It was, again, it happened so quickly, and I was comfortable. I did have the Valium, so you know that did make me pretty comfortable. But and then afterwards, the recovery was nothing. I went home. I was good.
And it's funny because share your story about what happened about a week after your treatment. Kind of, we're in Houston, and it starts to rain. That was tropical storm Imelda.
Right. That's right. That did happen right after. But I was stuck in the car, coming from work, and didn't. Any other time I would have died. But the fact that I had had that treatment made it bearable because I was stuck in the car for hours.
Right. Because it was the day that we had a tropical storm come through Houston, shuts down.
I had forgotten about that.
Shuts down the city, right?
Completely.
And there are parts of the city that are flooding. It's like, you know, Hurricane Harvey Part 2. But thank God wasn't that involved. But it really did impact a significant amount of the Houston area. And many people like yourself were stuck in their cars for hours. And so you told me about how your son and your dad came and picked you up.
My car was stuck. So my son and my dad came to pick me up. And I had already been in the car for, you know, a couple of hours at that point. And then it took us another 2 to 3 hours to get home. There was no way before that I would have been able to tolerate that.
Yeah.
And I went, you know, from all of that time without having to go to the bathroom and still feeling fine. Yeah. Of course, you know, by the end of that, I was like, please don't turn down another street. Just let's get to the house.
Plus it's raining and all the water and that but that was exciting because that was really a test of the procedure. You were literally stuck in a car.
There was nothing I could do.
So exciting. And you were driving for some time and then, so you really couldn't drive.
Do anything.
And everything else. So that was exciting. So that was immediate impact on the urinary urgency and incontinence, and exciting. That's Houston for you. It'll flash flood in a blink of an eye. So so good. So it's another protective for being stuck in your car for 6 hours while it rains. So, well, I'm excited, and I have to say thank you for being my first patient that was willing to trust me with the procedure and willing to share your story. It really means a lot to me, and I'm sure there are countless women that are out there that are dealing with the same issue and are really looking for a solution that can be comfortable, can be safe, can be scarless, and I'm excited to be able to offer that to patients. And thank you for sharing your story.
Thank you. I appreciate it because it's really changed my life.
Awesome.